This is the left side lying knee toward knee activity from Postural Restoration Institute. The purpose of this is to drive some right glute max of the right side and a little bit of adductor on the left side for external rotation of the hip on the right, internal on the left. To start with this activity, we want some sort of towel roll about yay big underneath the left waist. So that way the hip can still stay on the floor, but we have a little bit of a crunch right here in our left, which is going to allow us to recruit those left obliques and have them work with the left adductor and right glute. So now we're here, and we're in a 90-90 position. We want to start with the right leg in line with the knee and the hip. So this foot is a little bit further up on the wall. Now what we want to do is we want to initiate a slight tuck of the hips, very good, to neutralize our pelvis. And then we want to feel the ball of the big toe right here on the right and the inner edge of the heel on the right, while still keeping the left foot flat on the wall. This is going to allow us to feel our right glute a lot. So what we want to do is feel that push into the wall, and we should feel just a tiny bit of right glute, just doing that without doing anything else. Now keep that pressure on the wall, but maintain a little bit of outside foot contact, which you're focusing here, and push that right knee forward without losing your hip tuck, and then slightly up, focusing on not losing that foot arch. Only go as high as you can without losing that foot arch. And then breathe through this position for one breath cycle, in through your nose, out through your mouth, focusing on feeling your glute. It should be your lower right glute right here, and potentially a little bit of right outside hip, but mostly in the lower right. And then after you establish good control and good recruitment of that right glute, keep feeling your left foot flat on the wall and slightly lift your left knee up, just a hair, and that should give you a good bit of left adductor. Now maintain this position as you exhale through your mouth, and you should feel these left side abs engage as you complete the exhale. Hold on to those as you inhale through your nose. So he feels his lower right glute, his left inner groin, and his left obliques, especially on that exhale. And he's maintaining that as he inhales through his nose. Some people in this activity will struggle to feel their lower right glute. Don't worry, that does happen with some people. It's not overly abnormal. If this is you, you can try a couple of easy things. The first thing you can do is you can start with the right foot slightly ahead of the left in just a very slight staggered stance. And then you can focus on pushing the right knee forward and up, but make sure you're not losing your hip tuck. If you extend, you're not going to be able to feel that right glute nearly as much. So stay slightly tucked throughout the duration of this activity. The other thing you can try if you're not feeling your right glute a lot is put a band around your knees, just very light. We have about 2 out of 5 in terms of the intensity of the band. Usually a yellow or green one is pretty light, and you can try that. It shouldn't be so much to where it's pulling your knee down excessively, but it should allow you to push that right knee forward, push that right knee up without losing that right foot arch, the most important thing. And then just go through that activity, and it should cook your glute a little bit more there. And this is also a progression from the regular activity without using the band. The two most common mistakes we see are, first and foremost, is as that right knee is forward and up, there's a tendency for them to roll on the outside of their leg right here and foot, and this is not what we want to see. We want to make sure that that foot arch contact is being maintained. So make sure you're feeling ball of the big toe right here and also the inner edge of the heel. The other thing that we see is as we lift the left knee up, the right knee comes back. Now we're not actually going to be getting nearly as much of that right hip external rotation as we're looking for. So keep the right knee going forward and only lift the left knee up so much so as the right knee doesn't come back even 1 inch. And that's going to be exactly what we're looking for right there.